Hi everyone, it's me again, Dr. Tan Iping, consultant obstetrician and gynecologist. Today I'm going to talk about one of the topics that was requested by one of my followers on endometriosis. I like to talk more about this topic, especially to many of you. You will know that I love endometriosis, and for some reason endometriosis also love me. They tend to look for me. Okay, endometriosis, as I've mentioned many times, is a disease because of the backflow of the menstrual blood causing problem, and there are three types of endometriosis. We have endometriosis in the ovary, endometriosis in the uterus, and extra-ovarian endometriosis. So there are three types of endometriosis. Endometriosis in the ovary, which usually give rise to cysts. Some people like to call it chocolate cyst. And the endometriosis in the uterus, we call it adenomyosis or adenomyoma. And then we have extra-ovarian disease, which is endometriosis other than the ovary and the uterus. So because the endometriosis can go to many organs, we can see it in other than uterus and ovary. You can have it in the bowel, large bowel, the ureter, the bladder, appendix, small bowel, stomach, liver, kidney, in fact anywhere, lungs, heart, anywhere. Some that comes out onto the skin, onto the surface, also we've seen it. In our fats, also we've seen it. So basically endometriosis can go everywhere. And because it can go everywhere, the symptoms that it gives rise is different. Every different place gives you to a different type of discomfort, but generally it will be a form of either pain or discomfort. So for endometriosis, how do you cope? The biggest problem with endometriosis actually is the pain. A lot of people get pain from endometriosis, and when they get pain from endometriosis, it sometimes can be unbearable. It can be simple pain, as in pain only during menses. I always describe the pain of endometriosis as the pain that is growing in intensity. So initially, number one, intensity. So initially you feel the pain bearable, later it becomes unbearable. Later you need painkiller, and then later painkiller tablets cannot, you have to go for injection, and then last of all, injection also cannot, you don't know what else to do. And the extreme cases, there are actually people who resort to very strong painkillers like morphine based drugs, where they actually go to hospital to get morphine to relieve themselves from endometriosis. So pain, the intensity will go up. Number two, the duration of the pain also will increase from just period 1 day pain to 2 days pain, to 3 days pain, to after that before period, during period, after period also pain, and the extreme cases, pain whenever you feel like having pain, and the pain can come every day. Okay, so that is the extreme cases. And so two things about their pain, and the third thing about the pain is the pain changes in nature. Because endometriosis is a disease that spread over time. So let's say now your pain is only at a certain spot at the center. Then after a couple of years you start to have pain on your left. Then after certain years you will have pain on your right. And then after some time you starting having pain when you pass urine, you have pain when you pass motion, and then some cases they have pain when they have backaches during period. Some people have pain that go all the way to the legs during period, and some people have pain that can even come when you breathe, you know. So depend on which organ it goes, so the pain can be different. So everybody's pain for endometriosis is different. But there's one peculiar thing about endometriosis. It is a cyclical pain. So the pain follow your menstrual cycle. So it either come every month during period, or even if you have pain every day, it's usually worse during period. Or it can be during certain time of your period, either before period, after period, or at a fixed time like mid-cycle ovulation. A lot of people feel they have ovulation pain. I will tell that ovulation pain is endometriosis. So it's a cyclical pain, a pain that happens at a fixed time every time in your period cycle. So when you look at your calendar, you'll know whether your pain is endometriosis. The pain can be anywhere. It can be headache. It can be anywhere. It can go anywhere. Endometriosis can go anywhere. So wherever it goes, the pain will be different. So what are the pain like? Somebody asked just now. Let me go through. Yeah, Nurliana Zainuddin asked about what are the symptoms of bowel endometriosis. There are many types of pain for bowel endometriosis. Some people, they experience constipation, but this constipation gets better during menses. So actually this is a form of bowel endometriosis. Some people, they only have like diarrhea like that during menses. So normally every time menses come, they feel like something like a diarrhea. May not be very bad diarrhea, but maybe every time you go toilet once a day, right? But during menses, you go 2 or 3 times a day. This is endometriosis, okay? So that is bowel endometriosis. Of course, the extreme cases, they even pass blood. So you think you have piles or hemorrhoid. But this piles or hemorrhoid very funny, you know. That means you go past motion and then you got blood coming out. But it's very funny, it only come out during period. So if you have piles or hemorrhoids during period, it's not piles or hemorrhoid lah. It's endometriosis. I have seen one lady who had this thing, and because she thought it's piles or hemorrhoid, she never came to see a gynae. And then she went to see a colorectal surgeon, so the doctor that operates on the bowel. And then, of course, being a colorectal surgeon, they do not know endometriosis that well. So he also didn't know what he was dealing with. At the end, he removed part of the bowel. And then after removing part of the bowel, then you send for testing, right? And then when he sent for testing, only he knew that this particular lady actually had endometriosis. And then only he would come and see me. So he sent the patient to see me. And then I was like, oh dear, actually may not have required such a big surgery. Okay, anyway, so the topic for today, mainly we're talking about how to cope with endometriosis. Okay, because the pain can be unbearable, so sometimes to a lot of women it's quite desperate, because it's either between surgery or painkiller. So between surgery and painkiller, everybody know painkiller is no good, but everybody also scared of surgery. So between surgery and painkiller, so these are the thing that makes them in a very dilemma, because do not know which to choose. Okay, let me first explain to you why they have pain. Why do endometriosis people have pain? There are few reasons of their pain. Number one is due to the endometriosis itself causing inflammation. Because endometriosis itself, that wherever it is, it will cause inflammation. That's why for bowel endometriosis, you have diarrhea. Because it's the same, when you have food poisoning, you have inflammation of your bowel, so you have diarrhea. Then you have, so if endometriosis also causes inflammation of the bowel, so you have diarrhea. Endometriosis of the bladder, also the same, it causes inflammation of the bladder. Urine infection causes inflammation of the bladder. Endometriosis also causes inflammation of the bladder. So they have the same symptom. That's why a lot of urine endometriosis women, they didn't know they have bladder endometriosis. They thought they got urine infection. But very funny, urine infection only come during period or before period or after period. So if your urine infection follow the period, then it's endometriosis. You can also have period pain. Period pain, the normal period pain, actually it means there's inflammation of your uterus or your ovary or your tube. Period pain should be more central because that's the uterus. But if your pain is all on the left or the right, then it's more of the ovary and tube. So again, it's inflammation. If you have infection, like some women after childbirth, they may get infection of their uterus. They will also tell me they got period pain. So it's the same pain. Endometriosis and period pain and infection pain is all the same. Same with stomach. Sometimes you can get endometriosis out of the stomach. So some women, when they get menses, they vomit. So why? Because if you have food poisoning again, if you have food poisoning that is mainly affecting your stomach, you will vomit. So if you vomit during menses, then you also got endometriosis. So their symptom is the same as inflammation, because inflammation causes pain. So the first reason for pain is inflammation. So that is the first thing. The second reason for pain is not due to inflammation, but due to things that happen as a result of endometriosis. Endometriosis like to cause one big problem. It causes adhesion. That means inside your tummy, everything is stuck to each other already. So you have your bowel stuck to your uterus, your bowel stuck to your ovary, then your bowel stuck to everything else. And you must understand, everything else inside your tummy is alive, it's not dead. It has to move, it has to function. So let's say your uterus and your bowel is stuck to each other. And then for that day, you ate something really full, and so your bowel need to stretch. So when it stretch, because they stick to each other, so when they stretch, they're going to pull on something else. So you're going to pull on uterus, they're going to pull on the area that they're stuck together. So because of the things that stuck to each other, they also can cause pain. Okay, so endometriosis can cause things to stick to each other. We call adhesion, and adhesion causes pain. So you can have pain because of inflammation, you can have pain because of adhesion. But this adhesion pain does not follow your normal cycle. It does not follow the cycle. It can happen anytime. Okay? And third, there is another type of pain, which is a programmed pain. You program yourself to have pain. What we will call program, our brain works in such a way. In order to have pain, first you have inflammation. The inflammation stimulates the nerve. The nerve brings message to the brain, and the brain receives it as pain. But you can also program your nerve to have this pain every month, even if there's no more endometriosis. We have seen many women actually with no more endometriosis. They have done so many surgery, and again you look inside, no, nothing. Why she got pain every month? This is program pain. And in what sense we call it program pain? Program pain, one example I show you. Okay, like you eat lemon. When you put lemon in your mouth, you feel so sour, and then you release a lot of saliva, right? So if every time you eat lemon, your body will produce saliva. One day, I don't have to give you lemon. I put you the lemon in front of you. Put just in front of you this piece of lemon. You also produce the saliva. But the lemon never go inside your mouth while your mouth produce saliva. This is what we call program. The saliva is released because you program your brain, your body, the nerve to be stimulated. So now you didn't even eat the lemon. The nerve inside your tummy already stimulated. Go to your brain, tell your brain to produce saliva. So in some of the endometriosis women, they actually do not have any more endometriosis, but they still have a lot of pain because every time the period comes, the body program the nerve to be stimulated to tell the brain to cause the pain, to tell the brain to receive the message of the pain. Menses equal pain. So you program yourself. So some women, actually the pain is not due to endometriosis anymore. It is a program pain. So there are 3 reasons why people have pain for endometriosis. 3 reasons. So because there's 3 reasons, there are 3 different ways to deal with it. Okay, first of all, we want to deal with the disease itself. So if you're talking about if you have endometriosis pain because of the inflammation that the endometriosis causes, then there's only 2 ways. One is control the inflammation. Control the inflammation means you will take painkiller. Painkillers, but not any painkiller. You must take anti-inflammatory painkiller. So the common ones that you always take, Constant, mefenamic acid, Voltaren, naproxen, Brufen. These are the common anti-inflammatory painkillers that you have out there. So if you take anti-inflammatory painkiller, then it will control the inflammation. It will not get rid of the endometriosis, but it will control the inflammation. But of all the painkillers in this world, this is the painkiller with a lot of problems. A lot of women are allergic to it. A lot of women, once they take it, they get gastric pain. So because the side effect of this painkiller is gastric. So, but this is the only one that is effective in controlling inflammation. All the other painkiller that doesn't cause gastric and also very little allergy, those painkiller is only controlling it's a form of painkiller, but it doesn't control the inflammation. Okay, of course, the other same, Emma asked about Celebrex and Arcosia. Celebrex and Arcosia are milder anti-inflammatory. It's not so effective because it only block pathway. If you will understand the pathway of inflammation, there's 2 pathways, but Arcosia and Celebrex only block 1 pathway, but those anti-inflammatory painkillers block both the pathway. They are called NSAIDs, non-steroidal anti-inflammatory painkiller. Okay, so if you want to control the inflammation, you need to take those painkiller I mentioned. So number 2, of course, the other way is to get rid of the endometriosis lor. To somehow get rid of the endometriosis, or to control the endometriosis, which is back to the treatment of endometriosis, which I mentioned in my earlier slides on endometriosis. 3 treatment on endometriosis. You see, everything in endometriosis is in 3. So there are three main ways of controlling endometriosis. Treating endometriosis, either by getting pregnant, which can last you about 3 to 4 years pain-free if you get pregnant, or go on medication like Bisane. If it's very severe. If it's not so severe, you can always go on milder, like the oral contraceptive like Yas or Yasmin. Okay, but this will only control you during when you take the medicine. The pain will come back about 6 months to 1 year after you stop the medicine. And of course, last of all is to have a proper surgery. I like to say proper surgery. Okay, complete surgery. Because today I met one lady, I'm very sad. The moment she come into my room, I already keep getting my head. I don't know what to talk to her. She has 3 surgery, 2017, 2018, 2019, and now she's 2020 in pain. I really do not know what to do with her. She went 3 times to the same doctor to have the same surgery done, and the thing keep coming back. You know, when you go back to the doctor and the surgery is not complete, that's why it grows back within a year. So very important to have a proper surgery that clears everything. Don't just simply get a surgery done. Okay, so this is how you going to treat it. If you treat it completely in a surgery, the pain should go away forever. Surgery, a complete surgery could nicely last you 5 to 10 years. That is if you only do surgery. If you do surgery, I always complement with another complementary treatment. Then it should be a lifelong thing. You should only have 1 surgery for the rest of your life and not 3 surgeries. Okay, number 1 will be, as I said, to treat the inflammation. So that is the first thing. Number 2, the problem of pain is the adhesion. Things stick to each other, things have problem. Adhesions, there's no way you can solve it. The only way is you need to do a surgery to remove, to separate everything away. Okay, to separate everything away. Okay, that's number 2. Number 3, we talk about program pain. And in fact, I believe that most endometriosis patients actually suffering from program pain. Why? Because some of you may already have surgery before. Surgery already done, medicine taken before, disease has already probably cannot see on scan, or even you see on scan, it's not as bad as before, but you're still in pain. Okay, the ultrasound already showed that you're a lot better, but you're still in pain. So why? And then another thing is, as we grow older, our hormones actually reduce. As we grow older, our hormones are less active, less strong, so it's a weaker hormone. Actually, weaker hormone also don't stimulate endometriosis so much. But a lot of time, even though we are growing older, we find that our pain is getting worse and not better. So why is that so? Because sometimes it's program pain. Is that a lot of women, I have a lot of women who come to me, already operated 2 times, 3 times, 4 times, and then when you talk about operation, the answer is no. And I tell them, well, there is one option. They ask me, is there any option? Okay, of course, yes. You can go on medication for the rest of your life. You have no pain. Okay, you take Visane until you menopause, or Yasmin until you menopause. Of course, you have no pain. But of course, if you take any of this medication, is something whether you're willing to take. Some women are willing. I have seen many women who take for many years and they will not stop, because to them is, I'm not going to face the pain anymore. If this medicine doesn't give me pain for 1 year, 2 years, I'm not going to stop it. Yeah, some women are very willing to take all this medicine to treat an endometriosis. But not all women are willing to take. Or some of you already tried the medicine and you don't like the side effects, because all medicine has its own side effects and it's very individual. Some of us are okay with the side effects, or we don't feel any side effects. Like for me, I have endometriosis before. I took Lucrin, I'm happy. I take Yasmin, I'm also happy. I have no problem with any of this medication. But I know some of my patients who come to me, they actually have some side effects and they're not willing to take those medication because of the side effects as well. So then, what choice do you have? You don't want surgery, you don't want medicine. Then what? What's next? Actually, this group of women, whenever they come to me at this type of stage, I usually send them to my counselors, my therapists, because very often it is only program pain. And true enough, I have so many of such cases. After I send them to my therapist, settle. The program pain gone. Some of them, there are many types of cases that I would send. First group of people would be the group that scan nothing, but they are in a lot of pain. They already have previous surgery. They know they got endometriosis, but you scan nothing. I send, and they don't want any more surgery because I say endometriosis sometimes ultrasound cannot see. Maybe you need a scope only can confirm, but they don't want. Then they don't want to go on painkiller. They don't want to go on Vicene, and then they don't want surgery. I send them to therapist. Settle. No more pain. No need painkiller. I've seen some women pain until cannot sit, cannot stand, cannot lie down. Send to therapist. No more pain. Because it's a program pain. That is one group. Another group of women already got multiple surgery and still in pain. Scan nothing. And yet they're willing to let me scope again. Okay, scope again. Scope again. Nothing. No endo. Why pain? After the scope, they tell me pain again. You see? This is all up here. Send them to my therapist. Settle. No more pain. Settle. Then there's another third group of people. Third group of people are people who you scan, you know there's something. You see adenomyosis. Adenomyosis is very painful. And as long as you don't remove your uterus, you don't solve the problem. But many of these adenomyosis people, women, they cannot remove their uterus, or they're not willing to remove their uterus, or they still have no children, so they cannot remove their uterus. So this group of women, no point going surgery because you're not going to remove your uterus. Then you're not going to solve your problem because adenomyosis, you have to remove uterus. Then if you cannot take painkiller, you want to get pregnant. Sorry, not cannot take painkiller. Take painkiller until no use already. Painkiller is not working anymore. Still in pain. Then you cannot take Vicene because of side effect. Or you cannot take Vicene because you want to get pregnant. Then how? Go and see my therapist. Settle. So simple. I have one, I would call it a miracle. I always call this a miracle because I didn't expect the outcome. Her adenomyosis is very bad. She's not single, she's married with no kids. Never got pregnant all her life. Could not get pregnant because of all her endometriosis and her adenomyosis. And her adenomyosis is growing bigger and bigger and bigger and bigger each day. Very scary. Keep growing bigger and bigger, and her pain cannot stand already. And then now, every month she admits herself in hospital. The hospital doctor will call me. This patient admit to hospital because of period pain. Admit for injection, inject for 2-3 days, she's happy, she go back. And then next month, same story. And next month, same story. And then every time she's in hospital, I ask her to remove your uterus lah. 40 over years old, you keep also, you can't get pregnant, you might as well just remove it. And she don't want. At that time, she will say, okay. Then she go back home, then she don't want. And then the next month, she will come back again. Then she say, okay, I'll remove my uterus. And then after that, she go back, she don't want. And then the cycle go on like that. I say, please go and see my therapist. The last time I saw her in the hospital, her adeno is 12 centimeter. Very big. 12 centimeter adeno is very big. Guess what? She went and see my therapist 4 times only. 4 sessions only she went. 4 months later, she came back and see me, pain-free. And what is more surprising is when I scan her, your adeno now 8 cm only. From 12, become 8. To me, miracle. Why? Did my therapist do magic? In a way, yes. Why? Because number one, we solve her program pain. Because she programmed herself to have pain. Sometimes the disease is there, I agree. I always tell a lot of patients, the disease is true, but the pain need not be that bad. Your disease is true. I understand you are suffering. I understand you have endometriosis, you have adenomyosis. But your pain need not be that bad. Sometimes the pain is worsened because, number one, you program the pain, you already programmed the pain. Number two, you have fear over the pain. Because when you have fear of the disease and the pain will worsen. And you are also probably very stressed. Okay, sometimes you will realize, among those of you who have endo, you will realize you have period pain every month is horrible. I know. You go on a holiday and you have your menses. During your holiday, your menses, the pain will be reduced. You ask yourself yes or no. Why? Because you are relaxed, you are happy. I have also one woman who came and see me, I think a couple months back, just before the MCO. She has so much period pain, so much. Scan nothing, but she believes she has endometriosis because she scanned. She has so much pain. She can't get pregnant, so she thinks she has endometriosis. She asked me to scope her. Then I arranged the date of the scope after her period. Then when I saw her for the hospitalization, she told me that, Doctor, funny this last period no pain. No period pain. I wonder why. Then I asked her, want to scope now? Scope lah. Scope lah. Scope went in. No endo. Then why she has so much period pain every month? And then the final month before surgery, she has no more pain. Why? Because she's no more stressed. She's no more stressed. She thought the scope is going to solve all her problems. Stress gone, pain gone. So, endometriosis pain very often is up here. First is because you know about the disease. And next, you are very stressed about the disease. And when your period comes, you're so scared. The pain is worse. That is why when you go and see my therapist, what my therapist does is, she solves all these problems. She solves your program pain, your brain do not program it anymore. She solves all your stresses and your fears that you have. Because that's what they do, all these psychologists people. They elevate fear. You have fear of heights, you see a psychologist, no longer fear of height. You have fear of cockroaches, you see a psychologist, no longer fear of cockroaches. You fear of your disease. It's very easy to settle. When you look at how they do it, and I see how these therapists solve the problem of pain in the endometriosis women, actually it's not that difficult. Only 4 sessions, settle everything. So simple. So now you understand. Not all endometriosis pain is totally due to physical reason. You have endometriosis, I agree. But the endometriosis need not be so painful. The pain is due to 1, you program it. Number 2, you scared of it. You fear it. That's why you have a lot of pain. So that is why part and parcel of my management for all my endometriosis women, I don't just do surgery or give medicine. I ask all of them, especially those stage 3 and 4, to go and see my therapist. Because few reasons. Number 1, why I ask them to see therapists. Number 1 is I want to get rid of their program pain. They're all programmed already, they have pain. I want them to get rid of their pain. That program pain, they already programmed. Menses equal pain. We have to get rid of that. Another thing is, we also know that stress itself worsens endometriosis. Stress itself causes more endometriosis. So if I don't solve your fear and your stress and your anxiety, I'm not solving your problem at all. Surgery is not 100%. So that's why I make all my all my patients see. But of course, not everybody will see lah. Not everybody listen to doctors one ma. Okay, let's see all your questions. But if you ask me, I have seen miracles done by my therapist. So if you want miracles, you need to see my therapist. Why are my therapists different from other therapists? Because their therapists specialize in women's health. They do nothing but see women with gynae problem only. They do not see other problems, so they become very specialized. Okay, let me see some of the questions that have been posted up. Will endometriosis cause high CA125 cancer marker result? How do we overcome that? Okay, not all endometriosis got high CA125. Yes, some will have. How do you overcome that? Treat your endometriosis, either by surgery or by medicine. So simple. You get rid of endometriosis, your CA125 will go back to normal. That's simple. Okay, so bowel endometriosis, I've talked about that just now. Urine endometriosis, symptom almost same as urine infection. Yes, if you have urine infection every month, same time, then you know you're having bladder endometriosis. What is the root cause of endometriosis? Number one, backflow of period blood. After backflow, think about it. Every woman got 3 outlets uterus. Every woman also got backflow one. But some women, after the period blood backflow, the woman can get rid of it, but some women cannot. So some women cannot. That is the problem. So when you cannot get rid, so this period blood find a place to dry up. So the initial stages, usually we will just see like as though dirt on this wall, you know. So those very, very mild one, we actually see like got dirt on the wall. You just scrape, also can scrape off one. But over time it grow roots, and that's when it go deeper and deeper and deeper. And that's when it gets more and more painful. Yvonne says she takes mefenamic acid, which is constant. Are there any dangerous side effects of mefenamic? Yes. Few things. Number one is gastric, and not just gastric, it can even cause gastric ulcer, which can cause blood bleeding in your stomach, and also kidney problem, because mefenamic acid is not good for your kidney. That's why I say painkiller is not a solution. If you are on painkiller every month, you should find a solution, because you won't want to be on painkiller and end up having gastric ulcer and vomiting out blood. You won't want to be on painkiller and end up having your kidney failure. So Yvonne, if I were you, I would treat my endometriosis properly, not by using painkiller. Okay, you either go for medical treatment for endometriosis, surgical treatment of endometriosis, or try and go and see my therapist. Maybe that the pain will go away. I've seen many women with very, very bad period pain, and all they did was just see my therapist. Picchu, hi Picchu. So what if no experience of pain? Should it be alarming? That means you have endometriosis but you have no pain. If you have endometriosis and you have no pain, should you worry? Yeah. Because endometriosis, earlier I mentioned there are 3 types of endometriosis. Endometriosis in the ovary that causes the cyst, endometriosis in the uterus that causes adeno, and third one is endometriosis everywhere else. Okay, adeno can be quite painful. Endometriosis everywhere else can be painful, but endometriosis in the ovary is not painful. So you see a cyst, but you have no pain. So these are the people, you still have a cyst. The cyst can still be a problem because endometriosis still have 3 to 5% cancer risk. So you still need to sort out your cyst, either with medicine or surgery. So Zahara say every month she see doctor for painkiller, so for endometriosis. So Zahara, I hope you will not go on like that, because painkiller is not a way to go. Why? Number one, of course it control your pain, but they have side effects, and another problem is it control only your pain but not your disease. Your endometriosis continue to grow bigger, your endometriosis continue to spread. You take painkiller, only solve your pain for that month, and effective painkillers are no good for your kidneys and your stomach. Yep, you got Alahan too, must be also the good painkillers, so you end up with not so good painkillers. Adenomyosis, I mentioned that. Okay, so adenomyosis is endometriosis of the uterus. It can be quite painful. So again, but the only way to solve it for adenomyosis, I mean, if you're going to do surgery, then you have to remove the whole uterus. If not, then you go on medication like Visane long term. If not, then go and see my therapist. I told you, 12 centimeter adeno shrink to 8 centimeter just by seeing therapists, reduce the stress and reprogram the pain. You need to reprogram your pain. Emma says that she did a surgery in 2014 stage 4. Now my endo came back. More painful and prolonged since I first got for endo. But my doctor say no need surgery, just take Lucrin and Visane. Yes, of course there's no harm just taking Lucrin and Visane, but you only need to know you need to be on medication forever. It's just how fast it comes back. Because medication, I also give a lot of women medication. I say, if you don't plan to have baby, just take Visane lah. You can't get pregnant anyway on Visane, but you have to accept the fact that you cannot get pregnant on Visane. Then you just continue on Visane. But there's only a problem with Lucrene and Visane. Everything shrinks. You feel good, but disease, the root is still there. You cannot stop medicine. You can stop Visane and change to other medicine, but you cannot stop all medicine. Let's say one day after 1 year you take Visane, you decided I don't want to take Visane, I don't want to take any more medicine, then the endo will come back. Endo will come back. Surgery, if done properly, should last you at least 5 to 10 years. So if your endo just came back, then I believe your last doctor did a good surgery. But I think your biggest mistake was between 2014 and 2019, what were you doing? You were sitting around waiting for the endo to come back. It will come back slowly lah, because period blood will backflow again ma. So why didn't you stop the period blood from backflowing? Why didn't you stop your period from coming? Or that's another way. If you can stop your period from coming, then no backflow. Simple. That's why for me, I have endo. I have endo 20 years ago. I was operated 20 years ago. It didn't come back. Why? Because I made sure it doesn't come back. I'm always on some medication to prevent my endo from coming back. And I also do see my therapist. 20 years, no endo. But if you sit around and wait, then endo will come back. That's why women who come and see me for endo, I always tell them that you cannot forget about your disease, because the disease don't forget about you. So you need to be on some preventive measures until menopause. That is the key behind endometriosis. It doesn't matter whether you got pregnant or you do surgery or you take Visane and Lucrene. You still need to take something else after that until you menopause. Okay? So Visane, of course, Visane and Lucrene you can't take long term lah. You can only take maximum 6 months. But Visane you can take forever. You can take, not say forever, I mean 3 to 5 years, at least a lot longer. But having said that, all medication has its own side effects. So when you think about the thing, you really need to weigh. I always leave it to my patients to think for themselves. You have to weigh lah. Side effect of surgery, side effect of medicine. Both also got side effect. See which one you like better lah. Okay, if you don't mind, some people take Visane very happy. Like for me, Lucrene, I'm so happy. Visane also, I'm happy. I have no side effects with any of all this medication. But not everybody have that, you see. So you have to really think about the side effects of Visane or Lucrene before you think about whether you should take that long term or should you face the surgery and also the risk of a surgery. Yep, Emma, adenomyosis, the only way to have a permanent cure is to remove your uterus. You can be on Lucrene and Visane long term. Adenomyosis will be okay, but it's not permanent. I do not know about therapists, my therapist, because these patients that my therapist only worked for me for maybe the last 3-4 years. So the last 3-4 years has been doing good. All those of my endometriosis patients with bad period pain that have been seeing my therapist, they are relatively good. In fact, the first that I've seen, I think 4 years ago, she recently visited me a couple of months back, still pain-free. I still remember this lady. She has so much pain during her period. Husband had to carry her out of the bed. Pain until she cannot get out of the bed. Husband would carry her out of the bed and send her to my clinic for an injection. But all I did, there was this one time I said, today my therapist is free. Please see my therapist now. And this lady was amazing. This therapist of mine was amazing. She just saw her once. And that's it. 4 years, this lady is pain-free. Okay. But for this lady, her endometriosis is very mild. Her pain is very severe. I'm not sure about people who have very bad endometriosis, how long can the counseling last. But this lady has mild endometriosis, but her pain is very severe. So settle with just one session. Okay, Azhar Abdul Kadir asked a very, very good question. What is your option for adenomyosis if you want to do IVF? IVF, adenomyosis is also a problem for IVF because IVF has a high tendency of failing when you have adenomyosis. Partly it's because adenomyosis releases a lot of toxin, and with all this toxin, even if you have the best embryo in the lab, if I'm going to put it inside uterus, the toxin may kill the embryo. So the only way with adenomyosis, we know one thing: not all adenomyosis will fail IVF. Most of them that fail IVF, those that get pregnant with IVF, you tend to be milder disease. So we need to make you milder disease. So we cannot get rid of adenomyosis unless we get rid of your uterus. But we can reduce your disease to the very minimum. I had cases of very bad adenomyosis that conceived. Initially they couldn't conceive, then after that they conceived. Either, depending on severity, some is after surgery. We reduce as much, we take out as much adenomyosis as we can, and then straight away go and do IVF. You don't wait, you don't wait 6 months, 1 year, 2 years, Take out the adeno and do your surgery and do your IVF immediately. So you reduce, because we know adeno will come back, we can't get rid completely. So the chances of coming back is very high. So you don't want it to come back, because come back then you go and do IVF, then no use already, then your surgery is a waste. So you do your surgery and immediately you go and do your IVF. So normally after surgery, you cannot do IVF. You have to wait 6 months for the wound to heal. So during that 6 months, go on Lucrine, and then after that, immediately go and do your IVF. I have, of course, those that are not so bad one, that after surgery conceive on their own without IVF also got. And I also have one interesting Middle East lady who, the person who asked her to go on Lucrine long term is not me, it's her doctor back in her country. And she believed that doctor so much. I told her, cannot, Lucrine cannot take so long, got a lot of side effect one. But she die, don't want to stop. Because she's period free, means she has no more menstrual pain. Menstrual pain, she suffers so long. So many years of menstrual pain. She don't want the menstrual pain to come back. She die, want to go back on Lucrine. No matter what I tell her about side effects, she won't believe me. She just want to go on Lucrine. She went on Lucrine for so many years, Thank God nothing happened to her lah. Then one day she got married. Then she got married, she stopped her Lucrine. She got pregnant. I was like, okay, got pregnant, good. But that was how many years of Lucrine? 3 years, if I'm not wrong. She die won't. Okay, Kamaji called us. Hi doctor, what's the probability of endometriosis coming back? The probability of endometriosis coming back is almost 100% if number one, you don't want endometriosis to come back. There are a few things, the prerequisite of it. Number one is early surgery. The fact that you're stage 4 means you're not early surgery already. So if you're late surgery, which means that there's a chance that not all endometriosis was removed, because the second criteria is complete removal. Most of us remove cysts, but we don't remove all endometriosis, because all endometriosis can be anywhere. It can be your bowel, bladder, anywhere. So if stage 4, there is a high chance that it's not completely removed. So first criteria is early surgery. Second criteria is complete removal. So complete removal has to depend on how your surgery is done. Is it done robotic, laparoscopic, or open? Open is very hard to remove completely because I can't even see everything. I can't see your entire tummy. So number 2, who does your surgery? Because not many doctors do complete surgery. So the technique and who does the surgery matters. Number 2. Number 3, are you on long-term prevention? So you see, even for people whom I think I have removed 100%, I still put them on long-term prevention. Long-term prevention has to be number 1, medication. You don't need something strong, you just need something mild. Maybe oral contraceptive pill, long-term, or put in a Mirena, long-term. And last of all, stage 4 endometriosis, you must settle your stress. See my therapist. If you don't settle your stress, stress brings the endometriosis back. So you have a surgery in 2015, and the cyst was 8 centimeters. You delivered a baby in 2019, which is good news, because pregnancy is a way to cure and prevent endometriosis. So let's say you are so lucky, you remove all your endometriosis in 2015, so it's down to 0. It slowly want to come back, because if it's complete removal, it comes back very slowly. Very slowly. It has to start from 0 because all the roots removed. So start from 0, it slowly want to come back. But you got pregnant, then it went back down. Now it's again what happened to you after this. Get pregnant again. So after you give birth, it will slowly want to come back again. Then you get pregnant again, it go back down. So my advice to you, Karamjit is to get pregnant fast, okay? But once you've decided how many children you want and you've settled, or you really cannot have another baby now, then please make sure you're on some medication, okay? Don't just sit around and wait. Don't just sit around and wait, okay? Endometriosis comes back. Generally, we know that stress affects endometriosis. So, lifestyle changes that I would advise is things that reduce your stress and reduce the things that cause stress. So, take healthy diet and exercise, general well-being, as long as you're healthy. I think this rule of thumb applies for everyone in this world. Any disease in this world. Eat healthy, exercise, sleep well, and control your emotions. Reduce your stress. If you can settle all these things, you're generally healthy. Because the question is why the endometriosis stay in your body and not passed off. Why is the period blood in your body not got ridden by your body? Why other people can get rid, why you cannot get rid? So it's most likely you're not healthy. You're not healthy physically or mentally. So if you ask me about lifestyle, then that is general. Healthy physical and mental. Number 1, take care of your diet. You need to exercise. Maintain a good weight, no smoking, no drinking, sleep early and sleep enough, and no stress and emotions. Because when you have very bad emotion control means you're very stressed. So you see, everybody can change diet one. Everybody can make themselves exercise if they want to. But can everybody sleep early? Cannot. Some people have problems sleeping. Can everybody have a good sleep? Again, not controllable. Some people cannot. Can everybody reduce stress? Not all. Some can, some cannot. Because some stress cannot. You can't run away. And last of all, can everybody control your emotion? Most of us also cannot. So that's why therapists help. That's why seeing my therapist helps. Because therapists help in not just reprogramming your pain. Therapists help in improving your sleep, reducing your stress, and the way you view your stress, and control of emotions. So they're very good at that. All these people who are mental health specialists. Okay? So, can I get the surgery? Of course you can get surgery. But, as I say, make sure you get a surgery that is done properly. You need to get a proper surgery done. Because Sherry asked whether she can get a surgery done because she cannot cope with the pain every month. Of course you can get surgery done. Just make sure you get the right surgery done. And you probably need to assess whether you have programmed yourself from having the pain. So surgery can be done. If your endometriosis is really bad, then of course you can go and do a surgery. And if the pain still persists, then you need to go and see therapists. Anis Ayuni asks why endometriosis causes radiating pain to the legs. Yes, endometriosis can cause pain to the leg because where the uterus is, the uterus sits in our tummy down there. There's 2 nerves that go down. And your endometriosis can attack the nerves that go all the way down to your leg. That's why very interesting. People who have this, they actually get this leg pain, radiating, the pain that radiates down to the leg every day, every month during period. Which only means one thing, Anis, your endometriosis is extra ovarian. Yeah? Not just ovary or uterus, is outside the ovary and uterus as well as affecting your nerves. So that's why you're having the pain. Lee San So asked, I've treated my endometriosis 2nd time already, once in 2009 and recently period still pain. Recent check, high CA125. Your CA125 still high, then I wonder whether your surgery is complete. Because as I mentioned again just now, not many people do a complete surgery. Not many people in Malaysia who do a complete surgery. You can count with fingers one. So majority of women in Malaysia didn't get a complete surgery. So if your CA125 is still high, I think your disease is still there. And probably that is why your pain is still there. Because CA125 is a marker of the disease. Pain can be programmed, CA125 doesn't program. So most likely your disease is still there. So I would either go on long-term medication and forget about the surgery now, or maybe one day you just need to go for a surgery. But before that, I think I would still advise you to see my therapist. Maybe your pain can be not as bad, your disease is still there, but the pain can be reduced, then it can be more bearable, and hopefully that can tahan you for, can last for another many more years before you need to opt for the final surgery. And please look for the right person to do your final surgery. Okay, left back pain. Oh my god, this one. I would first thing want to check your kidneys. I've seen many doctors who miss the kidneys. We go and do surgery, we remove the cysts. Then we forgot to check the kidneys. I have a few patients whom the doctor missed the kidney and the kidney died off. First thing I want to do is to scan your kidney during your menses. Scan your kidney during your menses. That should see whether your kidney is okay. Okay, I have been talking a lot about the surgery, the right surgery. I have to tell you what's happening in Malaysia. Sometimes I have to be very honest. When I first started as a doctor, as an O&G specialist, not just a junior doctor, when I was an O&G specialist, the very first time I had a stage 4 endometriosis, I was so shocked. I don't know what to do. Stage 4, so complicated, I don't know what to do. Because to be very honest with you, endometriosis surgery, especially stage 3, stage 4, is the most difficult surgery to do for gynae. So I saw a stage 4, I don't know what to do. So I called senior. That time I was in government hospital, so sure got senior. So this senior doctor came in and tell me what, Dan, what are you trying to do? Please rupture the cyst and wash and come out. That's what she taught me. That's what my senior taught me. And she's like in her 40s. That's what she taught me. She's number 2. She's my assistant to head of department. She's very senior. She taught me that. That's what I did. Wash the cyst and come out. You know what happened when you wash the cyst and come out? The cyst is still there. Next month you scan, the cyst will still be there. Next month you do your CA125, it will still be there. Then over time, because I keep attending a lot of conferences and workshops, then I noticed that actually you're supposed to remove the cyst. Okay, then over time, I learned that I need to remove the cyst. But even after I remove the cyst, I still find that there are still people that the cyst come back very fast. 1 year, 2 years, you grow back. Why? That is when I started growing. Because those days I was still in government, okay? Then I started coming out to private. Then what did I do? I started to go overseas. I like to use workshop, conference as a holiday excuse to go on holiday. So I go overseas. One thing I get to go conference, next day I got to go holiday. So I like to go overseas conference. I don't like to go Malaysia conference. I very rarely attend Malaysia conference. Because sometimes after you go overseas, you find Malaysia conference nothing to learn. Okay, so I go overseas. I see people overseas, nobody just remove cyst one, They remove the cyst and they remove all the endometriosis, whether it's in your kidney lah, bowel lah, all remove one. Then you come back to Malaysia, nobody do that. So our teachers teach us to remove the cyst only. No, my first teacher taught me don't remove cyst, puncture only. My second teacher taught me to remove the cyst. But everything else, leave it there. So that is why in a lot of time in Malaysia, that's what you have. But now, not too bad. Because there are few of us who love endometriosis. I'm not the only one. There are few of us who love endometriosis. We go overseas. We go France every year. Train ourselves to know how to do it. So we learn from overseas. And I think one of them, Dr. Silva from Makota, is the first ever Malaysian who does that. And I think he feels very sad because Malaysia, everybody don't do that, right? He has been doing a lot of teaching as well. So the number of doctors in Malaysia now who can do a complete surgery is getting higher. But it is still the minority. I don't still think it's less than 10% of all gynaes. So unless you are getting the 10% of the gynaes to do for you, if not, most likely you did not have the complete surgery. First question I will ask you first, when you do your surgery, is it an open surgery? If it's an open surgery, I tell you already it's not complete. Because open surgery means you open one hole on your tummy, you can only see what is in that hole. You need to do a scope because when you put in a camera, then you go one round. Overseas, nobody do endometriosis with open surgery one. Whenever we go conference, everywhere is scope minimum. Robotic will be better. It's all about the visualization. Because laparoscope, we look at the image on the TV, is 2D. 2D, I can see everything, but I cannot determine the depth. And sometimes, the TV is placed more than a meter away from us. You must understand, you want to find good doctors, experienced doctors, old doctors, eyesight also not so good. But robotic is microscopic. Direct microscopic view, and as a result of that, we have 3D image. Image is better, disease is definitely clearer. That's why I really miss my robot, man. My robots are rested for 1 month because of this MCO. Starting already next month, okay? Sorry, not next month. Actually, starting, I just don't want to be the first to start. I let other people do first. End of this month, I start my robotic cases again. I really miss my robot because for endometriosis, robot is the best. Okay. Alright, so now you know why a lot of you get illnesses that keep coming back. Number one is, one of the reasons is majority of doctors cannot do complete surgery. But if you don't do complete surgery, it's fine. As long as you are on preventive medicine forever, and you go and see the counseling and settle your lifestyle and your stress. Okay? So it's fine. Ivory has many questions today. Ivory asks, will you stop your patient to use aromatherapy way to overcome their program pain? I won't stop. If it's effective, if it works for you, by all means go ahead. Okay? But to me, the therapy is not just for the program pain, but also to, in a way, reduce your stress so can control your endometriosis better. As I mentioned just now, my adenomyosis shrink from 12 cm to 8 cm. I won't stop people from using aromatherapy. Aroma is nice. How about constipation during period while having endo and adeno? Okay, yes. Some women is the other opposite. They have constipation during period. And this is again due to your endo and adeno. But it's not due to the inflammation, but it's more likely due to the compression. Because during period, your adeno, your endo, everything swollen. So it press on to the bowel, then you have difficulty passing motion. So you have constipation during period. In fact, any discomfort you feel during period, before period, after period, every month the same, is endometriosis. Okay, Kak Sida said she had gone through a surgery but still in pain every month. Why is that happening? I think I've explained already. It's either it's a program pain or your disease is still there. You only got two possibilities. So disease is still there. The only way to know is either you see it on a scan or you have to scope again. Don't want to go through surgery again? Go and see my therapist. Settle your program pain. Who knows, after see therapist 3 to 4 times settle. Or miraculously, that I got this one lady who has not much, and the endo, her endo is very mild. She only saw my therapist 1 time. 4 years now, pain-free. Pain when passing motion or passing flatus, especially when having menses. Yes, that's definitely endometriosis of the bowel. So when you have endometriosis of the bowel, Liana, when you have endometriosis of bowel, if you do not do a surgery that removes the endometriosis of bowel, then it's going to be still there. So as I said, maybe about 10% of gynaes can do that in Malaysia. So you really need to get the right doctor to do it. Mei Yin asks, will chocolate cysts cause difficulty to get pregnant? 50%. 50% of women with chocolate cysts still can get pregnant. 50% don't. First of all, must see whether your chocolate cyst is one side or two sides. Because chocolate cysts cause the eggs in your ovary to be toxic eggs. Toxic egg cannot give you baby. So if you have chocolate cyst on one side, the other side is good. The other side still can get pregnant lah. But if you got chocolate cyst both sides, oh, how ah? All the eggs are already toxic. So the chances of getting pregnant is not high. What is the difference between Visane and Yasmin for adeno? Visane is for treatment, Amy. Yasmin is for prevention. So it's not the same. Okay, Visane can treat. Yasmin cannot. So Lisan said that she cannot take Visane because she's very emotional, which I have seen in a couple of my patients. But if you ask me, it's not because of Visane, it's because of the person itself. If I'm a very emotional person, taking Visane will make it worse. If I'm not an emotional person, then taking Visane actually doesn't affect me. So I had this one lady. This one lady, what happened is that she already got 2 surgery and she tell me she don't want the surgery. No matter what happened, I don't want the surgery. She got adenomyosis, very big. How? And then she also got endometriosis, the cyst. And a lot of extra ovarian, the bowel and everything. Because when we check her, we can see everything is so stuck to each other. So she asked her to take Visane. Cannot. Very emotional. Cannot. What I did with her, I said, you take Visane, see my therapist. Settle. Now she take Visane almost 1 year already. No more emotional problem. Because my therapist solved her emotion. So sometimes you have to choose. You have to choose. You want to do another surgery. If not, then see the therapist. You no choice ma. Takkan you want to suffer forever, and it's not just to suffer forever. Don't tell me you sit down and let your disease progress and progress and progress. No, because if you don't treat it, you don't take Visane, you don't do surgery, the disease will progress. You don't solve your emotion. Emotion is a stress. If you are very emotional, you are already a very stressful person. See a therapist. Get rid of your stress. Get rid of your emotion. Who knows? Your pain will be settled. Maybe you don't need to take Visane so much. And this lady, we settled her emotion. She went and see my therapist only 3 visits. Only 3 visits. That's it. And now she can take Visane for 1 year. She's been taking it. She come and see me every 6 months to scan. And we see the things getting smaller and smaller. And she can take her Visane, no problem. Yi Peng asks, what's the risk of surgery to treat endo and will it affect the chances of getting pregnant? The risk depends on whether there are many organs involved. Okay, a lot of people like to say it's very risky because you must understand one thing. To gynae, when they see, ayo, endometriosis on bowel, don't touch, very scared. Risky. Endometriosis of the bladder, don't touch, very risky. That is the concept of a lot of gynae. That's why they never touch. But you think about it. You go and see a urologist who cut people's bladder every day. He'll tell me, ayah, bladder only ma, cut lah. He cut every day ma. You go and ask a colorectal surgeon who cuts the bowel every day. He cut only ma. So, that's why only a certain group of gynae who purposely go and learn. I have to learn how to cut the bowel, repair the bowel. How to cut the bladder, repair the bladder. How to cut the ureter, you repair the ureter. Because if I can do what the urologist do or the bowel surgeon do, then I can do everything. Then I no longer fear. But most of the time, I still get them to come in to make sure that I'm doing it properly. So my urologist, like for example, like I had one case, a bladder endometriosis. So I cut the bladder. Then I did it laparoscopically. Then my urologist come in. Urologists don't know how to do laparoscopy. They only know very basic. Their laparoscopic skill is not strong. They are more robotic surgeons than laparoscopic. So my urologist stand there and tell me, sew here, sew there, stitch there, stitch there. I follow his instructions. No big deal. To the urologist, he say, no big deal lah. He cut the bladder every day ma. So, because a lot of gynae very scared, so they not there to touch, and they tell everybody it's risky. It's because they do not have the skill to do it. Why they do not have skill to do it? Because of our Malaysia system. Our system in this Malaysia is like that one. Okay? So that's the system here, what to do. And will it affect chances of getting pregnant? That's a very good question. That's why if you want to have a good chance of getting pregnant, the chances of getting pregnant affected if you have multiple surgery. You should avoid multiple surgery. So how to avoid multiple surgery? It's not like I do a surgery and the cyst come back, I don't want to do already. No, cyst come back, you also cannot get pregnant what? So how? You have to do again, no? Or else don't get pregnant? No. To avoid multiple surgery is to get the first surgery done by the right person with the right method. If you don't do that, no one can help you. Just like somebody who came and see me today. She had 3 surgery done in 3 years at 17, 18, 19. The moment she walked into my room, I already keep turning my head already. I really don't know how to settle her. I don't want to operate on her because I know the more surgery we do, the more it's going to affect her. But if she's not going to get pregnant, what option do I have? Unless she can give up on pregnancy. I do have some women who give up on pregnancy, which I think it is a very wise move at times. Less surgery, don't go and traumatize your body so much. Just forget about getting pregnant. that is not a decision that I can make. So some women have to get pregnant, and that is the problem. So very important. If you're going to do a surgery, make sure the first surgery is done properly by the right person. 90% of the gynaes are not doing it properly, so be careful. Choose your gynecologist properly. Huda say, I am living in Japan. My doc prescribed me Gynaecologist for endo, and I gained 10 kg. Allah, the Gynaecologist never make you put on 10 kg. The Gynaecologist make you feel more hungry, make you feel happier. You want to eat more. Nothing, no medication make people put on weight one. All medication only make increase appetite. That is the problem. I always tell a lot of patients when I put them on medications that increase their appetite, I tell them, every time you feel like eating, you tell yourself, it's not, I'm not hungry. The medicine make me hungry. Okay? Don't eat. List next, ask if you have cured endometriosis near the anus, which is definitely possible. A lot. Because that is one place that many people have endometriosis anyway. It's completely doable by surgery. Or you can always take Visane for the rest of your life. Ning Pei asked whether can you take Visane forever. Okay, license no lah. Visane is still a very new drug. When it first came out, they say not more than 2 years. Then after that, they say not more than 3 years. And now they say more than 5 years. I don't know. Maybe as you wait and wait, it can be safer and safer. But there's only one problem with Visane. We worry about blood clotting, because Visane does make your blood clot, blood thicker. So this blood thicker, if you're young, healthy, okay lah. But if you grow older, like when you're in your 40s, then you got high blood pressure, diabetes, and maybe you're also obese, or you don't exercise, then we really worry about blood clot, because blood clot can cause heart attack, cause stroke. So as you grow older, it's not so advisable because of that. So if we say it's still more for younger women. That's why some women, when they talk about medication, I also sometimes tell them lah, once they take a bit longer, I will ask them, you still have to think about certain things, because this medication, as you take, as you grow older, it does have certain side effects for the older women, so you need to be a bit careful. Okay, yeah, 3 years on Lucrene. It's not my advice to take 3 years Lucrene, but yes, she died, I won't stop it. But God bless her, she had 2 kids after that. She got pregnant immediately after she got married, and after she gave birth, immediately again she got pregnant. And after that, she migrated to US. I don't know about her after that, okay? Sis Kecik asks, may I know PID can get pregnant or not? I'm patient of complicated endometriosis with tubal ovarian abscess, done 5 times op labs. I mean, I have seen very bad PIDs who conceive naturally on their own. So I don't think the PID is a very big factor, but rather PID, if already well treated, most of the time can still get pregnant lah. It's either you get pregnant on your own or by IVF. But I'm not sure about your endometriosis, so I also can't answer your question totally. But there is always possibility if surgery is done properly, and maybe you need the help of IVF. I don't know exactly, because depending on your situation. Yes, my therapist is at my clinic, and we do Skype. If you're not in KL, you don't want to come to my clinic, we can have it under Skype. I had my therapist have been doing Skype for people even all the way overseas, Singapore. And we had one Malaysian from Germany who did Skype with us as well, and her problem also solved. Even though it's totally Skype, never see that patient at all. Had surgery to remove my chocolate cyst, but came back a few months. Chiu Jermin, if your chocolate cyst came back in a few months, you must have met a doctor like me 20 years ago when my teacher told me just break the cyst and wash. Because when you break the cyst and wash, means the cyst is still there. That's why it's back in a few months. So you have chosen the wrong surgery by the wrong person. That's all I've got to say. Please choose wisely, everyone. Kim Yi, hi doctor, will it be a problem if take Visane on and off instead of long term? I think it's a problem, because when you take on and off, then your period come back like normal. On and off, whenever you stop, you have a normal period. Cannot be taken on and off. How about Dufaston? I bleed every 3 months. I bleed over 3 months. Dufaston is it's okay to take Dufaston, but I would say a very, very mild medication. So it's not really that ideal. It is probably, because you must understand Dufaston is a progesterone. So we have a lot of progesterone. We say it's a progesterone. True, we use progesterone to treat endometriosis. We say it's a very strong progesterone. That's why we tend to say you have a limit like 3 years, 5 years. But it doesn't actually have too much side effects. There are even other progesterone that are strong with a lot of side effects that cannot take longer than few months one. Okay, so we say it's still okay, but it's strong for endometriosis. Duphaston, yeah, it's like the mildest progesterone you can find. So depends on your stage of disease lah. Are you very mild disease, then Duphaston no. But if you're severe disease, Duphaston is not there. What if after remove the endo can get conceived? Can. Most people remove endo then got pregnant mah. Because they cannot get pregnant, then they do surgery, then they get pregnant. That's how we saw all those people who cannot get pregnant do surgery. How multiple surgery affect your chances of pregnant? Because if your cyst is in the ovary, every time we remove your cyst, we remove some ovary together with your cyst. Let's say you're born with 150 eggs, and then at the age of 30, you maybe left 100 eggs. And then every time you do your surgery, I remove 10 eggs. Then if you do multiple surgery, then you have a lot of your eggs being removed during the surgery. So yeah, the more surgery you have, the less eggs you are left. That is the only problem. Hi doc, may I ask if pregnant with chocolate cysts, will it affect baby? No. Baby will be well. Mother will be even more well because the cyst is shrinking. Okay, I have a couple of women who conceived with chocolate cysts and the cyst disappeared after giving birth. But they come back about when they're 4-5 years old lah. So very easy. After give birth, if you don't plan to get pregnant anymore, just go on some form of contraception, oral contraceptive pill, put on in the Mirena to prevent pregnancy, then your cyst will come back. Can Visane cause frequent urination? No, Visane does not cause frequent urination. The frequent urination is either due to the effects of the endometriosis as a reaction to your Visane, or it is due to the stress that you're going through, because Visane can make you more emotional, more stressful. So stress itself makes you urinate. One doctor told me mild endo and another doc say fibroid. Both done ultrasound. Oh, there's no way to 100% confirm whether you're adeno or fibroid. Every doctor in this world will have experienced once in their lifetime. They think it's adeno, they go in, they operate, it's fibroid. They think it's fibroid, they go in and operate, it's adeno. There's no way to tell by ultrasound, but you can tell by one thing. Fibroid, no pain. Adeno, pain. If you have no pain, fibroid. If you have pain, you're either having adeno or fibroid with endometriosis. Okay? Fibroid, no pain. That is the key behind it. Pure fibroid, no pain. But the only way to determine whether it's fibroid or adeno is by surgery. If your acid reflux is during period, then it's due to endometriosis. If your acid reflux only comes after you take Visane, I've not seen that, honestly. I've not heard of anybody with that. So I cannot, I probably need to know more about how your reflux comes. Lila Daniel asks, what are the chances of lab surgery for endo will affect other organs? The lab endo affect other organs if you have endo in other organs. Let's say you have endo in your bladder. Takkan I leave your endo in your bladder, right? So I have to remove the endo in your bladder. If your endo in your urethra, then I have to remove the endo in your urethra. So takkan I leave your endo in your urethra? Because if I leave the endo in your urethra, then one day your kidney will die. I had one case like that many years, a long time ago. A long time ago when I wasn't that confident to remove the endo in the urethra. So I had this patient with endo on the urethra. I called my urologist. Because he told me, no need to operate lah. Just take medicine. I said, are you sure? Because as far as I know, when I go overseas for conference, they say must remove. He don't want to remove. True enough, 3 years later, blocked the kidney. Kidney almost going to die. I have to operate her again. That's why I say no more such thing. If I see your endo in your urethra, I have to remove. Because if I leave it, later your kidney going to die, you will go operate again. Then you do surgery for what? So again, choose the right doctor to do your surgery here. Liz, again, after remove the fallopian tube, will endometriosis come back? Of course it will. I mean, if your endometriosis is totally removed, that means all the endometriosis on your bowel and your urethra and your everywhere removed. Then if you cut off all your tube, nothing backflow, of course you're safe lah. But What if you remove your tube, but you also leaves behind some endometriosis on your bowel, on your ureter? Those endo itself will spread. You do not need to have menses to backflow anymore once you have endometriosis inside your tummy. Endometriosis causes preterm labor. Adeno, yes, not endo, adeno. Hi, is laparoscopic surgery effective in remove endometriosis and fibroid? And yes, of course it's effective. Laparoscopy is better than open surgery, and you can do everything together. Your drilling and everything. Limping, which is better to detect endo and adeno besides ultrasound? And none. Laparoscopic is the diagnostic. Laparoscopy is the gold standard. Nothing is effective in detecting endo. Alright, I think I've answered all your questions, and I think we have a very, very long session today. Okay, so as I earlier said, to all of you that as in all my other talks, I am very free now because it's MCO. If you want me to give you more live videos, please just put it up in my post earlier on. There's a post that I created. I probably will create a new post after this. I'll create a new post after this. Put in your questions or whatever topics you want me to discuss. And you also need to go through all the comments and look for the topic that you like. I actually pick the topics with the most likes. Yeah. So if you just put out a question but nobody liked your comment, then I may not do the live video because it looks like nobody's interested. But for topics that people are interested, I am more than willing to do it again. Okay, so I have no more future plans because there's no, maybe I'll pick something from the list again, but I'll put out another post to see how. Okay, and I will keep you updated on my Facebook. So my typical time is 9 p.m. 9 p.m. is my time for live video. Okay, is it true? I have still some questions. You see, is it true, Lila? Lila asked, if we choose to change the doctor, we must go for surgery so the new doctor can diagnose us properly? Not necessary. If you have your video from your last surgery, that could be fine. In fact, we usually reassess you. From your story, we can roughly tell already. Okay? Not necessary you must have another surgery. Nuro Atika, hi doctor, if all endo have been removed from a good surgery, what are the reasons for it to come back? That's why I already mentioned, because number one, you want a good surgery, then it should not come back minimum 5 to 10 years. So if your cyst come back less than 5 years, most likely your surgery is not complete, because you and I won't know whether it's complete or not, except the doctor who does the surgery. So, but all my patients standard after surgery on long-term preventive medication and therapy. These two must go. Okay? So that's all. Thank you everyone, and see you on my next video. Yeah? Okay, bye bye.